The need for healthcare in our community is at a truly critical level, and at the same time we've seen shrinking resources in terms of support for nonprofit organizations.
The discussions just seemed to be so natural that together we could really make a huge difference as opposed to being separate, that we could leverage our resources, staff, programs, services, and provide greater access in Northwest Fairfax County.
Jeanie Schmidt is very grateful to its many funders who have supported it over the years, especially the Northern Virginia Health Foundation, which is our largest private supporter, and Fairfax County, which is our largest public supporter. We really are not in the position of being able to expand because of our space and our resources. At the same time, another organization had an opportunity to open a site in Herndon, and we got together and decided that we could combine our resources. We have some things that they don't have, and vice versa.
Well, HealthWorks for Northern Virginia was previously Loudoun Community Health Center, and we opened our first site in Leesburg in 2007. 2 years later, we started planning a second site in Sterling, primarily for access to children. And as a result of this merger, working together with Herndon is now our third site.
As our new entity, HealthWorks for Northern Virginia Herndon, we bring many gifts, such as our very strong volunteer program and our diabetic group visit program. In addition, the Community Health Center has a wider capacity for patients than we have, so we will have more patients and a greater diversity of patients.
Our missions are extremely similar. They're definitely different in terms of the two models, but this does allow us to then look at the best of those two models and bring them together. If nonprofits and other organizations, especially with similar missions, are all on their own paths, think about the duplication of overhead and some of that effort and cost.
Sí, el servicio que la clínica ha ofrecido y ha sido muy excelente. A mí me operaron y en 2 ocasiones he sido operada y ellos me han tratado de ayudar lo más que han podido. Y tanto moral como un médico, ¿verdad? Fue estupendo.
Our new center is located in a neighborhood where many of our patients live, so it's very accessible to them, especially those that don't have transportation. These are folks that they work 3 or 4 jobs, they struggle to take care of their families, and their health care has not been attended to.
Well, we'll get the opportunity to work with all different nationalities. It's a wonderful opportunity to know other cultures, and we also help them to understand the healthcare system here. They feel like they're supported and that some people care for them.
And we see them blossom. We see our individuals who've been too sick to go to work actually are able to go back to work. Parents can take care of their children, and it's a wonderful thing to see the difference in their lives once they're having regular health care provided.
I've been a patient here for 1.5 years, and the quality of care that I've received here has been exemplary. The doctors truly care, and it's close to home. I would not change doctors with the care I've received here.
Right now we are facing a major cost issue in terms of healthcare and access in our nation. And if we could get a model such as this that brings the community together, brings those resources together so that we are working together, we've got to find a way to minimize the cost of access and also make a difference in the health of our communities.